Good afternoon, everyone. Welcome to our webinar, Prescribing, Security, Safeguarding Patient Data in Healthcare. I'm Sam Cantor, I'm your moderator for today. I'm delighted to introduce the speakers for today's webinar. We have Erin Bands, the Director of Client Development at Charles IT. On this end, we have Kathy Smith, Practice Administrator at Radiology Associates of Hartford, and Dina Castricone, in the middle, Privacy and Healthcare Attorney at DMC Law. Just like I started this and didn't realize that we were live, we've been talking about this for the last 30 minutes already as it is. I want to say hello and thank you to each of you. The quick overview about this. The overview. These days, it's more critical than ever to know how to protect patient data against evolving cyber threats in the healthcare space. So what steps can you take to keep patient-sensitive data out of the wrong hands? Our industry experts are here today to teach you essential strategies for protecting your patients and healthcare organizations from cyber criminals, and also sharing insight on how to stay up to date with HIPAA, which, for the record, is spelled HIPAA, compliance. Any technical issues, write in, let us know. At the end of this, we'll have a Q&A, so if anything during the course of this process pops up in your head and you're watching this video, write that, and at the end of this conversation, we will do that. All right, that's all the housekeeping stuff that I have, so I'll throw that off to the side. And I want to say hello to you guys. Can you just give us a brief introduction? Kathy, first off, tell us who you are and what you do.
Sure. Kathy Smith. I am the Executive Director for Radiology Associates of Hartford. We are located in Hartford County and provide professional imaging services in 5 offices throughout the county, and I manage all of the physicians and the operations for that practice.
Dina?
Dina Castricone. I am the managing member of DMC Law. I'm a privacy and healthcare lawyer. I've been practicing for over 22 years. I specialize and focus in health privacy. I also teach health privacy law at Quinnipiac School of Law.
Erin?
I'm Erin Bands. I am Director of Client Development at Charles IT, so I help make sure that all the different teams and departments at Charles IT are being used to the highest and best use for our clients, and whether that is compliance, whether it is the account management, service functions, projects, our teams help liaise to make sure the clients are getting the best experience, and so I'm excited to be here.
So I know that we started before we went live the conversation, getting into some of the depths of this before we even get back to where we were 5 minutes ago. What is HIPAA? Let's start from there. And I think that from having conversations with you, with all of you, I'm learning that from the cybersecurity side, that's a little bit different. So Dina, you and I were talking about this a couple months ago. What is it? Again, I joke because we've joked offline about the spelling of the word HIPAA.
Well, so I'll try not to give a whole history, but it's the Health Information Portability and Accountability Act. It was designed to ensure that information was portable, transferable for payment purposes and for people to change providers. Believe it or not, its original intent had nothing to do with privacy. The P in HIPAA does not stand for privacy, which is surprising to most folks. But when they were legislating all of this, it became clear that patients were concerned about the privacy of their data when it was being moved electronically. So there is a big push and focus in HIPAA on protecting patient information. And HIPAA, the way we experience it in the healthcare sector, is really broken into a couple of key parts. The HIPAA privacy rule, which deals with the privacy of information generally, the HIPAA security rule, which is what we're going to talk about quite a bit today, protecting electronic protected health information, and the breach notification rule, which if you have a problem, how individuals are notified and how HHS is notified. There are other portions of HIPAA, but really those pieces are the ones we focus on primarily in the healthcare industry.
Kathy, this is every day, right?
Every day, every minute of every day.
Is this difficult to keep up with all of this?
It is, I think, from an education standpoint. When you bring on board new employees who have never worked in the healthcare space, there's a lot of education that needs to happen so that they understand it and comply with all of the components that we've put in place to protect our patient health information. And then and we've talked about this previously, the ongoing educational requirements for our staff. folks tend to get very comfortable in their workspace, and comfort isn't necessarily a good thing in healthcare. You always want to be kind of on that cutting edge and making sure that you're following all of the HIPAA rules.
It's a lot, right? I mean, there are a lot. This is not you check a box, your computer's up to date, you're done, right? I mean, you're dealing with clients all the time to work through all of these updates and stuff.
It can be a journey, and I think everyone's at various stages of that. But yeah, our goal, and we were thinking earlier, I think, about some of the technologies that may be like a broadest paint stroke. But yeah, it can be a challenge for sure. And like I said, our goal is to help figure out where you're at there and put in the right strategies.
Strategies. So it's a lot, right? I mean, this is not just like a hardware thing, right? This is hardware, software, training. How do you start? How do you
I think one of the keys about the HIPAA security rule, which is really what we're going to focus on today, is that the rule itself says that you just have to take reasonable steps, which means that the same requirements won't, or the same expectations don't exist for a solo practitioner as a hospital system. And so this is really important to understand. What's reasonable for one practice may not be reasonable for another, but reasonability depends on where we are in the world. And today, where we're in the middle of cyber attacks and ransomware, which didn't exist 15 years ago, we have to be cognizant of those threats and make sure that there are protections in place that address those particular threats. And again, what that means for a solo practitioner and HIPAA security compliance and what that means for a hospital system are really going to be two different things. And that's why it's important to understand the big picture of the HIPAA security rule so that you can understand what your compliance obligations are. Everybody's obligated to have policies around how they're protecting that data, but what you actually do to protect that data depends on what's reasonable for your particular practice.
I mean, it's constantly happening, right? I mean, you probably are constantly getting, I mean, we have spam email tests, right, in the company, but there are probably people who are constantly just sending emails out to millions of people hoping that something's going to stick, right?
Absolutely. And receiving those emails from, different organizations looking for patient information, and immediately you open an email and say, well, this wasn't sent in a secure manner, and you can't obviously reply unless you reply in a secure manner. But yeah, I mean, it happens, all day, every day.
Wow.
With everything that we do.
We see that prevalent no matter the industry, that even recently there's such an uptick in even what is spam and phishing emails.
I was just going to talk about phishing, right?
It must be brutal, especially in a healthcare space, for even the workforce and the employees to know what is clickable and what's not. We see a lot of people like really stressed, like, I really think this is an email, but should I click on it? And that's where our teams do help with that guidance. And Sam, you alluded a little bit too about the training aspect, because there are a lot of tools and technologies that are important to train your workforce what to look out for. And that's been a key strategy as well, going back to things you can do.
And to follow up on training, I think one of the keys for training is not a boring PowerPoint presentation.
Right.
We've talked about this. The simulated phishing messages with follow-up. You can't just do a simulated phishing email, have someone click on something they shouldn't click on, and then don't follow up with them. Those are highly effective training tools, and they're things that when you're thinking about training your staff, you want to look at the effective tools. The short videos, less than 3 minutes, providing tidbits, and the simulated phishing with follow-up are highly effective and really preferable to the annual same set of PowerPoint slides that people have seen year in and year out.
I mean, I fell for it right at the beginning. For me here, I got an email that it seemed like it was sent from my boss, and it said, I have, I've got access. Here's the access to the folder you were looking for. I had been looking for access to a folder, relatively recently before then, and I was like, is this real? Is this not real? I'm just gonna, click on it really fast and check and see phishing email. And I had to do training because I did that, but man, it looked real. It looked so real.
Yeah, and I think the more phishing, and I know for some of our staff, they're like, oh gosh, we get these all the time, you know.
Yeah.
But the more you send them, the more it makes people aware of, you know, am I supposed to, or they'll send them to me. Is this a real email? But it is important, I think, to keep that, again, like in the forefront of your mind.
Well, thank goodness on the simulation that it wasn't real.
Right, exactly.
The simulation, you click it and it's like, hey, you know, just so you know, and like you said, it's a follow-up. It does go through a bit of a retraining as a refresher. Just it has to be constantly on your mind, you know. But God forbid you did click on it and it wasn't a simulated phishing attack, right? I feel too like another component that is one of the things that I'm most passionate about is that two-factor authentication, right? So yes, someone clicked on it, maybe someone did get some of like a password, or you put some information in, but if those credentials do bleed out onto what they call the dark web, right, and have those password caches, at least rest assured that if they do try to get in from any other location, they're blocked because of that two-factor authentication component. So that to me is also just something we're highly stressing at Charles IT, that is almost like a table stakes at this point that every business should have.
And to follow up on multi-factor or two-factor authentication, that was one of the reasons that the Change Healthcare cyber attack occurred, was because they were using a remote Citrix account which did not have multi-factor authentication on it. And to think of the billions of dollars that have been impacted, or billions of dollars of impact and interruption of patient care and payment and all of these other things, because a simple cybersecurity method was not employed, is really just mind-blowing. So I couldn't agree more that whatever system you're using, you should be using MFA, and if there is some reason you can't use MFA, there needs to be some very detailed controls in place to make sure that the password is not compromised in any way. I still wouldn't recommend using a system without MFA, but
It's
absolutely.
like leaving the key to your front door of your house underneath the mat and putting a little sign that's like, it's right here.
Here's
Yeah,
the key.
it'll be fine.
So it isn't it's not required.
No, and so the HIPAA security rule doesn't require specific technologies. It doesn't require that you do specific things. It requires reasonable measures to protect the confidentiality, integrity, and availability of electronic protected health information. That's what it says. What that means, what it meant 10 years ago,
Right.
is different than what it means today. Today, what it means is MFA is absolutely basic standard of care.
Yep.
Long, complex passwords, absolutely something that should be used. Regular training, simulated phishing, all of these things, which may not have been reasonable 10, 15 years ago, certainly are reasonable and necessary today.
So I guess the question from a legal standpoint, I'm sorry, Kathy, I wanted to why is this not?
Right, that's what I was just going to ask.
Yeah.
So can we anticipate that there'll be a change to the regulation to ensure that elements like MFA or password security metrics are met?
So maybe, I'll give you a lawyer's.
Okay.
We heard from HHS earlier this year that they will be issuing proposed rulemaking to the HIPAA security rule, which has not been updated since 2003.
Wow.
But the fact that it's not been updated since 2003, it's not uncommon that it takes regulations that long to be updated, and it's precisely why it's never really a good idea to require a specific technology. Because could you imagine that if in 2003 we were required to use specific technologies that are maybe obsolete today? So I think I know we will see proposed changes to the HIPAA security rule. I do not anticipate that we'll see very detailed requirements about what you should be doing. I think we'll see some generalities around things like increased authentication measures.
Okay, yeah, right.
Use of industry standard encryption, because what was standard 10 years ago is not standard today. And interestingly, or maybe not, the use of encryption is not technically required by the HIPAA security rule. It's what's called an addressable requirement, which means it may not be necessary under the circumstances. Well, 20 years after that was written. It's required almost under any circumstance now. So we will see changes or proposed changes. I do not anticipate that they will be very prescriptive, do the following 12 things, but I think it will be a little more detailed than we saw in the original set.
What were you going to say, Aaron?
It was just more on the encryption piece, because I was actually going to point out, like Kathy, you said in the beginning too, sometimes if you accidentally get an email that may not be encrypted, you're like, oh, what do I do?
Right.
But I see encryption so prevalent as well as a, data security strategy. So I know too, right, like the common ones are going to be data in transit and data at rest. So I think it's important to point out, like, there's softwares out there, especially now, I think, like, whether you look at Mac, whether you look at Windows, now they just come with the encryption built right in. But it is important to essentially manage that and make sure, like, for example, we've had people lose their laptop in an airport, right? What if it had patient data on it? We can sleep better at night knowing that it was encrypted, and like you said, they're now even increasing from like 128-bit, I'm going to get technical for a second,
That's
but
okay.
256-bit, right? So they're increasing what those standards look like, but that is also a no-brainer.
Yeah.
And also the fact that in an email system, when you're transmitting data, especially outside of your organization to other providers, leveraging like what, for example, how Office 365 has those built-in encryption tools, making sure that the data when it's in transit also cannot be intercepted and decrypted before it gets to the proper recipient.
And just to follow up on email generally, because this is an area where we're seeing, especially with smaller healthcare providers, many data breaches. They're using email for transmitting information, oftentimes protected health information, more than most providers think, right? They say, oh, we don't email PHI. Yes, you do.
Yes,
Somewhere
you do.
It happens. And what some folks think is if they just encrypt the email when it goes out, that they're okay. No, that's sitting in your sent items. And if someone gets access to your email box, it's not encrypted in there. They can have access to it. So not only do you need to employ encryption for the transmission purposes for when it leaves the organization, you have to be concerned about the security of that data in your email. And for that reason, I recommend to all my clients that you don't maintain any information in your email longer than 90 or 100 days.
Okay.
You archive that so that it's not sitting there and available to to hackers. I will tell you, the last 2 or 3 email breach situations that I've dealt with, we were dealing with 10 to 15 years of email that was sitting in an active inbox.
With today's storage, everyone likes to hoard email and data, so it's interesting, you're right, to put a policy in place surrounding how long you retain that for.
I never thought about this because at one point, relatively recently, I was looking for something medical for one of my sons or for my mom, and I said, can you just send that over my way? I need it as soon as possible. And they said, we can mail it to you or we can fax it to you, is what they said, but we can't email it to you. And I said, what? I don't, and I guess, is that standard practice?
It is
is.
old school standard practice.
Okay, well,
So
it was an
there
old school doctor's office, so that's
there
not
is
surprising.
an old school thought that fax is no more, no safer.
I didn't
than
even have a fax number.
But there is sort of this carve out for faxes because it's through a telephone line, or at least historically used to be through a telephone line, which was excluded. The fact of the matter is that the patient can ask to have something sent in an unsecure manner. It's up to the provider to make sure that the patient understands that it's not secure, and if they'd still like it that way, the patient actually has a right to get the information in the manner that they want, so long as it doesn't put your systems at risk.
But the benefit of having patient portals
Right.
is it prevents all of that from happening, right? And then you have a secure portal that the patient really manages their own access and protects all your information.
All of the things that I had on my list here of the top actionable steps, without even prompting you guys, you knew. Not surprisingly, the only one thing that I have on the list over here is about access controls and establishing, access controls to limit data access to authorized personnel. That's the only other thing that was listed on that. I'm assuming, obviously, that's in reference to making sure that the right people, that the person who's, I don't want to say the person who's answering the phone isn't the person who knows, every little bit of information. The right people know the right things. How does that work? You know, is that just part of hiring an employee, you know, when someone comes into an organization?
I can maybe talk about that a little bit. Just, you know, when we're managing a network, right, and you have all the different departments of an organization, you have your finance team, you may have your physicians, you may have your IT individuals, you may have your administrative offices. It is kind of a, not every one of those departments needs to have the keys to the whole kingdom, right? So, for example, if we did that phishing scenario and someone did get breached for whatever reason, they don't have 2FA, you know, hopefully, you know, if they don't have full access to like where the centralized patient database is, they're only going to have maybe some QuickBooks records now that could still contain some PHI, but you are somewhat controlling or stopping the full spread of where they can get into the network and not. So a good strategy for access control lists is you have a nice definition of all of where your files are stored or where your databases and programs, and you have clear definitions of who can access that and to what degree and level, right? So like your EMR system, you don't need everyone to have the administrative privileges in that whole system. They should only have access to the modules that are pertinent for them to be able to do their job with ease, but not so much ease that they can see anything in case there is a breach. You want to make sure you have that cleanly laid out.
I wanted to go into that because, you know, we've kind of explained to people the things that are really important to have, regardless of whether they're required to have that. What are the biggest threats that people are facing now? You know, you alluded to this, you know, the difference between 2003 and 2024 is a massive difference. What are these greatest threats? Where are they coming from? Is it typically someone sending an email? Is it, you know, a phone call? I mean, where are these threats coming from?
So phishing attacks continue to be one of the top sources of malware and cyber attacks. And whether it comes through email, where you can now get these phone calls, as you said, or smishing as through text, right? Folks have to be aware of these risks that are out there. You have, you know, phishing, but you also, I think we have to recognize the fact that when you've got employees working for you, you are only as secure as your weakest employee.
Of course.
And if someone is careless with their password, if they're careless with information, that is a huge risk. So training addresses both of those things, but also having a strong sanctions policy, which is required by the regulation, and making sure you follow through. When an employee does something that's contrary to policy, you need to make sure you're, you know, following up with them, because your individual employees do pose the greatest threat to the organization, because they're the ones who'll click on the phishing email. They're the ones who could be careless with their password. And with respect to what Aaron was saying about access controls, organizations can have these technical access controls so that people aren't accessing, they can't access something that they are not able to access. But you also need to have access management systems, policies in place about who can access what. And in the smaller organizations, access management becomes challenging, because that's where you have the receptionist who has admin access to everything, because there are only 3 people in the office. You have to resist the urge to put convenience ahead of security, and in smaller organizations especially, wanting to have convenient access is what creates a whole boatload of risk for providers, and I'm sure both of you have more to say on that.
Yeah, I think even, you know, in a smaller organization, as we talk about, you know, password management, it's even, you know, locking your workstation if you have to use a restroom or you go to lunch. You know, in a common workspace, somebody could easily walk up and say, oh great, they're logged in, let me just look at Kathy Smith's record. You know, but the importance of logging off and locking workstations to protect your access to information, the employee's access, and protect your own password is really critical.
Which is such a low-hanging fruit, obviously. I mean, that must come with training.
It does, absolutely. And in a smaller organization, people are running around, and maybe computers are limited, right? And not everybody, there aren't enough, or it's not conveniently located, and so it just tends to, it's like the convenience factor. Oh, I'm right here, I'll just, log on and do whatever I need to do, but not under somebody else's username and password.
Right. Shared accounts on a workstation, especially in like
Right.
an exam room, could be a no-no at times, just because then the more people that have access to it, the more risk you have of that human element, and the less like access controls and stuff may come into play. So you bring up a good point of that as well.
Yeah, Erin, you're connected obviously to a lot of companies, and you're engaging in conversations with them when they first start out with, getting up to speed with the things that they need to have. Have you encountered at the beginning stages of the process with some companies that you go, oh God, you can't do that, this is not a good idea,
You have to be polite about that.
Yeah, of course.
Everyone is, no one wants to know that their baby's ugly, but
Yeah, right.
we encounter, and like I said, almost in the beginning, everyone's at various stages of that journey, or depending on the scale of the size of the organization that you have. But our goal is to go in there and help come up with an action plan of here's, maybe you're not, and that could be okay, right? But here's immediately, again, broad paint strokes. This is probably what you need to order of operations implement first to get to what you feel is like the reasonable, for your business, the protection of client data or patient data.
So I've learned some about things in the world of finance. I've learned some about things in the world of manufacturing. So as I enter into my own journey, understanding more about HIPAA, are we getting to a place now where all patient records and things need to be digital? Is that coming down the pipeline? Is that a requirement currently? It's not. Because I think the risk, obviously, with especially some of the organizations that have been around for a while, or smaller businesses, as we've alluded to, is that they have all the records on a piece of paper, and that's just sitting in a filing cabinet, and how on earth do you not know that someone has just gone and opened it up and walked into the building, and the secretary's in the bathroom, and they walk over and they take pictures of everything as they go, and you have no clue. Is that something that may come at some point? Is that something that's been discussed?
I don't think we'll see sort of government regulation of it must be digital, because there are various factors for many practices. And in terms of the kinds of, as long as you have sensitive data and people interacting with it, you will have breaches, right? In healthcare, there are breaches, whether it's accidental or malicious, as you've just described, somebody going in and taking a picture. Mm-hmm. The difference of the paper record error was that when you have a breach, you have 1 or 2 or 12 breaches. In the electronic error, you have hundreds of thousands, if not millions, of records that can be impacted through a particular incident. So the impact is much greater when things are digitized the way that they are.
I see what you're saying. So these things do happen, as you said, obviously. What have in all of your years of being involved in this, what sort of horror stories have existed? And you don't have to get too. We're not going to violate any HIPAA rules by talking about this, but it does happen, right? It does happen, and I assume that it probably happens in ways that you're surprised about. When you and I were speaking, Kathy, you alluded to an experience that someone who was maybe newer or something might have had. When these things happen, what do you do?
Yeah, it's really, it depends on the severity of the issue that has happened. But for instance, in our space, the rules of you looking at protected health information are only what you need to know to do your job. So if you are looking at Aaron's record because you're just so curious that he, tripped and fell down the stairs, and how could he have possibly done that, and he's my boss and I just want to go in there and just check him out. It's not only just education to the staff, but there needs to be some type of disciplinary action that happens as a result of that as well, and that people understand that places the whole company at risk, for legal action. And we have seen that. I have many friends in the healthcare space where I think all of us experience it's kind of like human nature, and that it takes a lot of education. to remind folks. And there's HIPAA audit trails and IT audit trails through all of those systems that you can record and look at that information.
So the compliance itself, right, is not so much as, Dina, as you've mentioned, it's not so much a page that has boxes that need to get checked and you have to do every one of them, right? You say, the words that you said, and I'm paraphrasing, maintain a reasonable or an acceptable level of security with it. What happens if a company is they just don't care? They're not worried about it. They're not interested in it. They're not, they're not staying up to date with the changing times, and they just are careless with that. Do you fall out of compliance? Is that the correct terminology? What is it called when somebody, isn't doing what they're supposed to be doing?
Well, sometimes these practices sometimes just float by and never get caught. So compliance is not something that you are. It is a process. Mm-hmm. Right? And it's a continuous process for every organization mm-hmm. in order to stay in compliance. If an organization has never been in compliance, they're not necessarily going to get caught if there's a patient complaint, if there's a desk audit, which is something that OCR, the Office for Civil Rights, which enforces HIPAA under the Department of Health and Human Services, they're doing more desk audits. And in fact, as we were talking about earlier, they've just announced that they'll be doing more HIPAA security desk audits. And that's where organizations are likely to be, where they're likely to find that there are issues. One of the other biggest areas where lack of compliance is uncovered is when there is a breach. And I know Kathy's familiar with the process when there is a breach. You have to report, you've got to notify the individual, and you've also got to notify the government. You've got to file a report with the Department of Health and Human Services and tell them what happened. That is one of the biggest sources of that the HHS uses to initiate investigations. And so when you do report the breach that you've had, many times there'll be follow-up from the government on that, and that's when they'll go through and they'll say, let us see your HIPAA security risk analysis, let us see your policies on X, Y, and Z that were potentially not in line with what happened with that breach. And then there'll be findings, and things will get ugly mm-hmm. from there.
How will they determine where to do desk audits? Will it be people who have had previous breaches? Is it based on, billing revenue, of the size of an organization? Because bigger isn't necessarily where the biggest risk would be, right? It could also be a very small practice that doesn't have the resources to be on top of the compliance aspect of it.
I think that they're going to be using the breach reporting mechanism and patient complaints. Mm-hmm. So OCR does collect patient complaints related to HIPAA directly from patients, and I think those two categories, breach reporting and patient complaints, mm-hmm. are going to be the thing that determine whether OCR initiates a full investigation, whether they send what's called a technical assistance letter, or whether they do a desk audit based on that. And so patient complaints, just to talk about them briefly because they really could be problematic, a lot of patient complaints can be avoided through regular communication with your patients. If you're having trouble finding a record, if you can't respond in time, making sure that you avoid having a patient complain to a regulator so that you don't get one of these audits.
You were bringing up a point before too, like if a situation were to occur, we're having a plan in place. So like I know you were talking about how do you hit that big red button, or like what is to occur when something like that happens, God forbid. But I know that's where I think you were alluding to, like Kathy, and a lot of practices have what they call like either a disaster recovery plan or any breach plan that is either educated or rehearsed and trained to the staff, and it also delineates like how to talk to press, who's in charge of what situation, when do you engage certain insurances or IT departments and things like that. So I thought that was something that I wanted to highlight as well, that is really important to have as a part of your strategy is what is the plan, right? Don't wait for it to happen to then try to figure it out. You want to go through some tabletop exercises and say, all right, we'll rehearse certain scenarios that if this occurred, how will your organization respond? So how, often do you find yourself helping? Is that something where you find prevalent people aren't prepared or have those policies, or is that something that you think is kind of another table stake?
So a lot of smaller organizations don't have these incident response plans, which basically are akin to the written description of a fire drill, right? What do you do when the building's on fire? We all understand that. We also all understand the importance of a fire drill. So you know how to find the exit, to mitigate the loss of life or anything like that. An incident response plan is very similar for IT security issues. And since the potential for loss of data is much greater when we're dealing with IT security issues, your organization should be thinking about in advance what would cause you to hit that button saying, this is an incident that triggers our incident response team. And so for many of my clients, we sit down and determine, all right, if there were an incident that involved fewer than 500 patients, the information of fewer than 500 patients, we wouldn't call that that's not a critical incident, that's a serious incident. And the reason for that is because the reporting mechanism to HHS triggers off of 500. Although the loss of information of 500 patients is still incredibly serious.
Yeah.
But your incident response plan should be looking at the most critical, we've lost all our data or lost control over all our data, to, all right, it's 1 or 2 records, how do we handle that? And there should be a process across that spectrum for how you handle all of that. And from my perspective, when you're investigating for HIPAA compliance purposes, whether you have a breach, you're doing a full investigation for the loss of 1 record, just like you're doing an investigation for 10,000 records. You still need to know what happened, you need to document it, and you need to have a process.
Isn't that a big component, if I'm not mistaken, of some of the original HIPAA laws, or even the, I know they kind of redid it a little bit back, I think in the 2000s, if I have those dates, my dates lately have been blurred together, but a lot of it comes back to, if something also happened, you need to be able to reconstruct how, so that you can notify patients if they were impacted or not. Is that a part of it?
So high tech in 2009.
You know me, keep going to the techie pieces.
Yeah, 2009 was where we saw the breach notification rule come together, and that is when you've got to notify the individual, and then you also have to notify HHS. And you have to notify HHS even if it's just one individual whose information was impacted. The timeline and whether you have to also notify the media depends on the number of individuals involved. But that needs to be part of, you need to have someone in the organization who at least has a basic understanding of how all of those things work, because the timelines for, notifying a patient fewer than 60 days. It says within a reasonable amount of time, but in no more than 60 days. And then the notification of HHS depends on how many patients are involved. So it's important to know what those timeframes are and have someone internally. I mean, every healthcare organization needs to have a privacy officer who should understand these things, and they also need to have a security officer. Sometimes they're the same individual. Sometimes there are, the more technical folks might serve as a security officer, and some organizations, it's the main provider who is the privacy officer and the security officer, because it's a very small practice.
Interesting hearing you say, so if something like this happens, there actually is a requirement to tell the media?
If more than 500 patients are involved in the breach, there's media notification within the geographic area where the breach has impacted 500 or more individuals. You've got to notify the media.
Oh boy.
So you have to tell the government on yourself, and you have to tell the media. And the information you've got to give the media is essentially the same information you have to give the patient on what happened. You have to tell them what happened. You have to tell them what the steps that you took, and how you'll make sure that something like this doesn't happen again. If it's a slow news day, you may end up, on the front page of the paper. But it has to be a prominent media outlet. You couldn't, pick the once a week.
Local patch.
The local newspaper that publishes once a month with some
And we
coupons.
saw that with the change it was everywhere. It was in every professional journal that was published. It was everywhere.
Well, I don't know that they've actually done their media notification yet. They didn't actually notify HHS about
Oh, they didn't.
the breach. I mean, this all came out because nobody was getting paid, and there were substantial issues that were happening. They may have since, within the last couple of weeks, issued the official notice to HHS. But yeah,
It'll be
Is
interesting to
there-
see what happens in the insurance industry as a result of the Change Healthcare breach. You know, I think most of my colleagues, we all carry different levels of, you know, IT insurance policies and cyber policies and, you know, all of those things to protect the business, you know, should a breach occur. But it'll be interesting, right? We see that with national disasters, how property insurance is, you know, escalating, the cost is escalating so high. It'll be interesting to see how it affects the healthcare industry.
I'm so glad you brought up cyber liability insurance, because I think it's really important that we talk about it. It's not required by any regulation, but because a cyber incident can have such an incredible impact on a business, it's really one of your mitigation measures should be insurance. You should
Right.
have
Absolutely.
insurance. And one of the things that will make insurance more affordable is if you have an incident response plan, like we've talked about. If you do
Yeah.
if you take these
The
steps,
training platforms.
It's part of the application,
two-factor,
actually,
'cause
right?
I do find with all of our clients, especially, you know, no matter the industry, but a lot of the cyber liability insurance drives a lot of their need to have some of the technologies we've described today, because like I said, one of the first questions on the form is like, do you have two-factor? Do you do training to your end users? Do you put these safeguards in place? It's not necessarily like some of the government regulations, it's the people who have to insure them that have to pay that out, you know, so they want to make sure you're doing everything you need to lessen that risk as well.
Exactly. And that's what I mean, yes, compliance is important, but it's also important to recognize that compliance here with the HIPAA requirements necessarily reduces the risk to your business for these cyber incidents. And so it's really good for business to get this piece of compliance right. And it's being required by the insurance. You won't be able to get insurance if you're not taking some of these steps. So all organizations should be looking at the kinds of steps that they can take. And the simple steps are the multi-factor authentication, making sure that you're configuring the systems that you have to be as secure as possible, looking at your email retention policy and your inbox, those sorts of things, to look at all of that. And I'm sure you have plenty of other examples. But even small providers and practices can do those sorts of things to reduce the amount of risk.
Absolutely.
My brain keeps getting stuck on this. You have to alert the media line. Perhaps it's my background in my career, but that, what I have written down here about, what things can happen, from obviously legal penalties and whatever, that is like, it must be a reputation killer, and if it's an organization that's not particularly large, you're not just talking a financial, a fine, right? And we can talk about that. It could shut their whole organization down, couldn't it?
Oh, absolutely. And nowadays, if your organization is not compliant and it has an issue, a cyber issue, because it's not compliant, that's essentially the end of that I mean, just think about what goodwill do you think exists for Change Healthcare right now? None. And reputationally, they're permanently damaged, as is United Health, because they're tied to them. And so the reputational aspect of this is huge, and it's especially important. And I see a lot of health tech startups. So they're not provider organizations, but they're providing services to healthcare providers. They're providing tech services. They get into this space because they think it's lucrative without a proper understanding of their compliance obligations as business associates in this space. And there's a lot of risk in what they're doing. And for them, it's the death knell. If you have a cyber incident and you've got this technology for healthcare, there's no way you're getting out of that. So there has to be, in the vendor space, those who are serving healthcare providers, an understanding about compliance. And you were talking
We were
earlier
talking about this earlier.
Yeah.
Vendor, you were almost going back to where a few things are flowing through my mind, but we were talking about how patient portals are so convenient. But if you're outsourcing the technology to spin up a patient portal, a website, and to get logged in, do you know where that's being stored? Do you know what access that vendor is putting into place to make sure that the data you're trusting them to store on behalf of you and your patients is kept? And so you're right, talking about a vendor risk assessment, right? Because what credentials do they hold? So there's a lot of different certifications out there that aren't necessarily specific to HIPAA, but absolutely surround and have overlap to how their data is controlled. So are they using two-factor on their side? Are they using all the same safeguards that you're expected to do, but on that platform that you're paying them to host for you is huge. So vendor risk assessments are something to our compliance teams. When you have an engagement with our firm, that's one of the biggest components of that engagement is just how do you vet out all of your vendors to make sure that the data you're trusting them to store for you is safe and secure like you're expecting it to be.
Right, because there are a lot of businesses that are connected into your business when you're doing that, right? For you, I mean, it's not just you stand alone, right? You've got lots of vendors.
Well, I was just going to, and we've been a client of Charles IT for a long time, but when we look at, it's not just our IT vendors, but all of our equipment vendors, who have access to all of our protected health information when they come in to do service or preventative maintenance. And just, Aaron, as you were saying about doing a vendor assessment, those vendors are changing rapidly all the time. And I think in a small, medium-sized medical practice, you need to be cognizant of that, right? And I'm going to start doing business with vendor X, Y, and Z. We need to onboard them in the right way and do that assessment.
Even your IT provider,
That's
right?
right.
Charles IT is a SOC 2 Type 2 compliant organization, which we're really proud of, right? There's a lot of effort that goes into making sure, because we have keys to other organizations, kingdoms, and healthcare situations, so we take our security measures and how we handle that data and even passwords very seriously. And we are, if anyone's like, hey, doing a vendor risk assessment on us, we're like, here's our SOC 2 book. Like, absolutely, we're very confident that we, will pass any of that. But, a lot of other managed services providers out there, they could be in the same situation, but you do have to know anybody and everybody who touches your business, how are they, treating their part of it as an extension of your business.
And if your IT vendor is not willing to respond to a questionnaire and they're not happy to share with you information about their certifications or what they do to protect information, walk away. The risk is just too great. The other thing, your business associate agreements, right? So when you engage vendors to do work for you and they'll have access to protected health information, you need to have a business associate agreement with them. The regulation sets forth what needs to be in the agreement, but it's a contract that you can add more to. And as a covered entity, you should be adding more to this agreement. This agreement, my standard business associate agreement, has language in it that requires a business associate to respond to up to quarterly questionnaires as we see fit to assess their compliance with the agreement. Requires them to use encryption, requires them to use MFA, has all of these other requirements in it, and this is a contract that you have with your vendor, so it's within your control. There are things you can do to take control over your vendors, and if your vendors balk at any of those things, it means to you that they're not doing them as a matter of course, and I don't think you want to be using an IT vendor that does things as a matter of course. And I'll say, not as a matter of course, one other thing about using new technologies, there are so many new technologies out there and everything's exciting, but anything that involves the use of protected health information you have to be wary of, and you don't want to be adding new technologies to your systems that use protected health information when you have existing systems that can do the same function and you've already tested those systems. If you bring in a new system, you have to test it. It's got to go through a HIPAA security risk analysis process before you can put it into production. So it's not always about using the coolest new tool that's out there. You've got to make sure that it fits within your security posture and that you've looked at that system and vetted that to your point, vetted that vendor.
We joked at the beginning of the conversation, because I'm sort of paraphrasing what you said when we spoke a couple months ago about the spelling of HIPAA, that if the IT firm that you're working with, spells it HIPPA, then you've got to run the opposite direction. And so you need to make sure that the people that you're working with are people who are experts in this, in that field, because if they're not experts in this specifically, then there could be grave consequences, as we alluded to, that go outside of you have to alert the media. There can be fines, right, that are associated with this. Can there be very large fines, very arduous processes in place when someone has something like this happen that they have to go through?
So they're called civil monetary penalties, and they have been assessed and can be assessed. Most regularly you'll see, or most frequently you'll see, a settlement between the Office of Civil Rights and the entity that they're investigating, so that they avoid a large CMP, but sometimes civil monetary penalty. But sometimes those settlements are 7-8 figures.
Wow.
So we've seen, we see settlements regularly in the millions of dollars, and in the most egregious, we see 8-figure settlements. Stay tuned. We will see something on Change Healthcare.
Oh, yeah.
I'm sure. I mean,
Right.
it will. Now, it takes the Department of Health and Human Services and Office for Civil Rights years to get through these investigations. So give it 3 to 5 years before we see the end result on this. But we will see something. On my website, I have blog posts, and every year I do a summary of enforcement and the things that HHS focuses on, and the penalties or the settlement amounts. So you can see throughout the years where enforcement has been focused. But yeah, we're talking hundreds of thousands, millions of dollars for the more egregious, those larger cybersecurity type events.
We do have some questions. Can I steal a laptop from one of you guys so we can get to those questions? Because we're starting to get closer towards time, and then I'll ask you to sort of summarize everything. Thank you very much, Deanna. Appreciate it. Okay, so whoever wants to just shout out answers to whatever these questions are. Just bear with me for 1 second. I'm just trying to pop it up and load it. Okay, so here is the first one. So as mentioned, some organizations can fly under the radar when it comes to requirements not necessarily being, quote, firm under HIPAA. Who within an organization should you be speaking with to discuss the importance of increasing their security posture? Is it the CFO? Is it the CEO? Is it somebody else? Who's the best person to do that with?
All of the above.
Okay.
The issue is that this needs to be a commitment by the entire organization to take this on. Yes, you need money, so the CEO. Yes, you need top-down support, so the CEO. If you've got a board, you definitely want the board to know and understand. This is why organizations that have, all organizations need to have a privacy officer, but that privacy officer should be carrying that message to leadership about what is necessary. And there are plenty of horror stories out there in the public domain that you can point to that should be motivating, and really, given you can take just a few small steps that will make a huge difference. So really focus on what would work best for your organization. You're not going to get an entity to agree to spend, $500,000 on a compliance program on day one. Look at things like MFA or a more secure email system, or something that's attainable, and work to try to establish a culture of compliance at your organization where it is part and parcel of what you do. The way I always describe it in my class is that health privacy is critical to the delivery of healthcare. Patients won't tell you what's wrong. You can't help them if they don't believe that their information is safe. So it is foundational to healthcare delivery.
Well, Erin, that's part of the process, right? When you come in to do this with a company, it's not spend $500,000 now. It is at first some of those low-hanging fruits, or the really, really big important things that you kind of go through, right?
Yeah. a big part of it, you're correct. Like Rome wasn't built in a day, and you're balancing how quick you want to get those things covered versus what you have available financially and cash flow and things like that. They're all businesses, right? But our job a lot at Charles IT, especially for our account management and compliance teams, is to really assess where you're at in that journey. We do come up with what we call a roadmap. We help you budget for some of the projects that you're going to have to undertake, and we help you prioritize, again, like two-factor, even the training, right? Going back to the question in terms of what are some small steps you may start to float up to those C-level people. If you start with that training, we use a platform called Know Before right now, for example, that's really powerful there, because if you start getting your whole organization into that mindset of putting security first and why it's important, including your C-level, they're not exempt from needing to take those trainings, right? That will help, I think, spark those conversations organizationally and get an organization to start off on that journey. But yeah, that's absolutely where we help budget for.
And I think in the healthcare space, I know, educating physicians even, they know about HIPAA, they know, how important it is, and obviously to keep information confidential. But, implementing MFA and Know Before and spending the funds related to that, and the importance of how that circles back to the whole overall HIPAA health assessment of your practice, I think is really a critical component. It's not just that C-suite, but
right.
Also the owners of the company.
Mm-hmm.
The next question that was asked: are there any compliances that overlap with HIPAA that could help healthcare providers with cybersecurity?
I'm not sure I understand.
There's a lot of compliances out there. Like Charles IT, for example, we do help people in the manufacturing space with certain regulations and compliances they have. The healthcare, even just a starter, right? Like you may have heard of cybersecurity framework, which is just general guidance on easy steps that you can take. And even like I mentioned, Charles IT being a SOC 2 Type 2 compliant organization, there is absolutely overlap with a lot of the same things, right? So whether you need, the majority is going to be your encryption. It's going to be your two-factor authentication. You may have also heard of some technologies such as SIM, which is Security Information and Event Log Management aspects. But so there's a lot of requirements that I do think tie in and out. They are all very much related, and they're all somewhat saying the same thing one way or another. So I don't have all the specifics, but there are, like I said, cybersecurity framework is a great, I don't want to call it a gateway drug, but it is the way to get started, because if you're meeting some of those items, you are, again, doing some of the more broad paint strokes with other regulations, including HIPAA as well.
This is another good question here. With the rise of telehealth services, are there specific HIPAA considerations or technologies that healthcare providers should be aware of to ensure the protection of patient data during virtual consultations?
Well, first and foremost, you've got to make sure that your telehealth platform complies with the HIPAA security rule. You've got to do a risk analysis on that technology. And if your platform provider is a third party, you've got to have a business associate agreement with them. Those are rules that were relaxed during the pandemic that are no longer, or enforcement rather, was relaxed during the pandemic. That relaxation of enforcement is now off the table. So if you're using technology that has not previously been assessed, you've got to do that assessment. You've got to make sure you have a business associate agreement with that vendor. You have to make sure that you've got internal policies about use and how you use that platform. For example, does it record? Will you allow folks to record? Will you disable that function? I am not a fan of recording things that happen on telehealth, but you need to at least look at that. You need to have policies around, if your providers are delivering telehealth services, are you prohibiting them from using public Wi-Fi? Are you prohibiting them from doing that session in a public space? Are you requiring that they be in a confidential space? Are you making sure that you are getting appropriate information to your patients about how to use telehealth? And if you have problems, we can't solve your technical problems. And then there are legal requirements around consent from the patient to use telehealth. But from a HIPAA perspective, you have to look at all of those privacy and security issues that surround the use of telehealth. Use of FaceTime is no good. Use of WhatsApp, no good, right? Those were technologies that folks were allowed to use temporarily during the pandemic because people had to get up and running so quickly with telehealth. Those are not acceptable anymore.
We're running out of time, so I want to just get to the end, the last question. I'll ask each of you from your own perspective of where you are the expert in that. Kathy, I'll start with you. From the business perspective overall, when referring to HIPAA, what would you say is the biggest takeaway that people that are in this space need to keep in mind?
I think a HIPAA assessment and education of staff. I think those two things help to prepare you and prevent you from making an error down the road.
Dina, what do you think?
I couldn't agree more with Kathy. You have to know where you're at, and you can only get there by doing an analysis of your systems, understand what your vulnerabilities are, and then training. You can't overemphasize the importance of training.
Aaron?
I have nothing different to say.
Piggyback.
I think it is. We even started, I think, off on that topic was the education and training of the workforce, right? So knowing the do's and don'ts, how to look out for suspicious emails, and how all those things pertain to like encryption and all that. Like that's just fundamentally the starting point of that strategy. Again, having I think an assessment done so then you know where you're at, and making sure you can also attest to where you're at is key. And then my only final and third plug would be multi-factor authentication. It's the broadest paint stroke you can have, I think, to start, guarding your house and making sure the doors are locked, like that type of thing.
Well, there's a lot of fantastic information, so I appreciate the three of you joining me and informing me as someone who's a layman about all of this. With all the information that you gave, we will put this full video up onto our website as well, and then have clips that we post onto social media so people can gain all this information. So thank the three of you. Thank you guys for coming and hanging out with me today.
Great.
Thanks.
Appreciate
Thanks for
it.
having us.
It was a lot of fun.
course.
Let's do it again soon.
Enjoy the day. Be well.